Hi, my name is Maggie Gill, and I'm the CEO of the Palm Beach Health Network, which includes Delray Medical Center, West Boca Medical Center, Good Samaritan Medical Center, St. Mary's Medical Center and the Children's Hospital, and Palm Beach Gardens Medical Center.
And I'm Julia Bate. I'm a nurse practitioner here at Delray Medical Center.
So we're here today to answer some questions about how we're planning for COVID-19 in the Palm Beach Health Network.
So let's get started on some of the questions that we've had.
Sure.
So a lot of the questions that we're hearing from our physicians, our nurses, community is how are we planning? What have we done to plan so far?
And we know there's a lot of concern out there about how we're planning, and obviously this is a dynamic situation. So let me describe first the groups that have been involved in the planning efforts over the past weeks and continue to meet on a daily, sometimes twice a day basis. So as being part of the Tenet Healthcare Company, we obviously have a lot of resources at our home office level. We have calls with leadership there twice a week. We receive information, we ask for support, we receive guidance. At the group level, we have a group incident command team that supports the incident command teams at the hospitals. And so all 5 hospitals have worked together to look at plans for patient care, staffing protocols, care pathways, how we segregate our patients, and how we plan for a surge. So those conversations are going on a daily basis. Each facility has its own documented plan, and I would encourage everyone to talk to your supervisor or director or manager if you have questions about your specific unit.
So a big question in the community is what are the symptoms and what are the criteria for being tested for COVID-19? Everybody has that question right now.
That's great. And I'm going to turn that question over to Dr. Osiami, an infectious disease physician at St. Mary's Medical Center.
That's a good question, Maggie. The symptoms for COVID-19 are as follows: fever, cough, and shortness of breath. Now, you could have some people that may not have symptoms immediately because it takes between 2 to 14 days to become symptomatic. Most people, however, will get symptomatic by the 5th day. So if you have a fever, cough, and shortness of breath, you should seek out your primary care doctor or the emergency room. Just give them a call and so let them know what's going on so they can advise you on what to do.
What is the criteria for testing COVID-19?
Great question, Maggie. The criteria for testing for COVID-19 is really simple. If you are not feeling ill, you should not be getting tested. If you have any of those symptoms that I mentioned before, then you should seek out testing. Keep in mind, this is a flu season, so there's also a possibility you could have influenza A or other viruses. So checking with your doctor to let them determine what test you need is the appropriate thing to do if you have symptoms.
And finally, what can we do to protect ourselves? What advice do you give to everyone to be able to stay safe?
The best protection is really hand washing and social distancing. So this virus is transmitted via droplet and in some scenario airborne. But majority is by droplet, meaning that if somebody coughs and you're within 6 feet of them, you can contract the virus. That means if you can distance yourself from a large crowd, you are less likely to contract this infection. Other means is by washing your hands. If somebody coughs on a surface and you come right behind them and you touch that surface, then you're coming in contact with the virus. So hand washing is very important, not only to keep yourself from getting infected from COVID-19, but hand washing also protects you from other infectious agents.
So another question that came up is what are we doing about if anybody is presenting with symptoms, illness, if they have to stay home, what are we doing for that for our staff?
That's a great question. So obviously with schools being out and businesses being closed, people are concerned about what if I have to be home. So we look at that through our group CHRO and the CHROs at each hospital. So what we've done is we've inventoried all of our staff, looking at people who are working on orientation at home, clinical staff, ancillary staff, as well as support staff. And we have the ability to rebalance our staff between hospitals should we need to. We feel like that as of today, we have a good plan to be able to maintain our current level of care and plan if we have an increased level of care. Obviously, it's a situation that we continue to evaluate on a day-by-day basis, and as things change in our external world, we have to adapt to them internally as well.
So from the new guidelines standpoint, they talk about checking for symptoms, checking for fever, all of those things. How are we protecting our patients and our staff in-house on visitors that are coming in and people that are coming into our environment here?
So in all of our emergency departments, we're screening for anyone who might have a respiratory condition or meets the travel questionnaire or has potentially been exposed to somebody with COVID outside of the emergency department. Each emergency department has separate screening and areas for those patients and the ability to keep those patients segregated from the rest of the population. So that's the emergency department. All other visitor entrances have separate screening as well. So we have enacted temperature screening. We ask the appropriate CDC questions, and we are asking people who might be feverish or who have traveled outside the country or have been exposed to anyone to not come into our hospitals. Our hospitals are for people who are sick, and we want to be able to maintain the safety of our patients and our staff.
So Maggie, a lot of these family members want to come see their loved ones, so we do have people that want to come in as visitors, and we also have patients that are coming in through our emergency room. How are we screening both of those, and what's the difference between the two?
Great question. So I'll take patients first. So patients presenting in the emergency room will be screened outside of the emergency room, so we can keep anyone who has a respiratory condition or a positive travel history or has potentially been exposed to somebody with COVID-19 away from the rest of the patients and segregated. We will also be asking screening questions for anyone who's scheduled for a procedure or surgery to make sure that we know ahead of time if anyone has answered any of the CDC questions affirmatively. On the visitor side, we want to screen every visitor, vendor, anyone coming into our hospital who's coming to see a patient or visit a staff member. And so we're asking the appropriate questions about travel, about exposure. We're also taking temperatures. We want to make sure that our patients and our staff remain safe. Now, every hospital is a little bit different in terms of how they're restricting their visiting hours, for example. At Delray Medical Center, because we have a high-risk and elderly population, we are actually going to virtual visits as of this Friday. For each hospital, you can look at their website to see on a day-to-day basis what their visiting hours are. Today, every hospital has restricted visiting hours. I could foresee in the future that restriction continue to move to eventually virtual visiting hours at most, if not all, of our hospitals.
We all want to protect our employees that are here. We want to make sure that we're protecting our physicians that are seeing these patients. In regards to supplies, how are we doing with that?
Yes. So let me just let everyone know that we are managing our PPE, our medical supplies, our pharmaceuticals, and all the supplies very carefully. We are monitoring our inventory on a daily basis at the hospital level, at the group level, at the company level. We're managing and focused on the appropriate use of supplies. We want to make sure we're not being wasteful and that we have protecting our inventory to take care of our patients and our staff. This might be a good opportunity, Julie, for you to demonstrate the appropriate use of PPE. I know a lot of people have questions about that, our staff and our physicians, and so can you just demonstrate for us what we do?
I'd be happy to show you PPE. So initially, to talk about PPE, that's personal protective equipment. So that's what we use when we have a patient that is under suspicion for COVID-19. And so those are patients that have been tested and we're awaiting results on. So at any point that we go in the patient's room or we have any contact with the patient, we start first with putting on a gown. So the gown is effective in protecting our clothes and anything that may touch the patient. So we go ahead and put our gown on first. So the proper use of the gown is that we tie it in the back and that we have full coverage on the sides and in the front. So when we do that, we make sure that we have good fitting, good tying in the back. And the next step is going to be putting on my mask. So that is a very important piece to the protective equipment that we use. This mask is fitted for our nurses specifically. They have been mask fit tested to make sure that we are getting them the excellent coverage that they need when they go in and see these patients. So in doing so, we always start with the mask like this, put it on over the mouth. We go ahead and take the strap, put it on, and then the lower strap goes all the way in the back underneath the ears. So when we make sure we have a good fit, we like to get a good seal around the nose. So that's my fit of my mask. These again have been already pre-fit. Our staff knows which size to use, our physicians as well. And so we have that from a protection standpoint. The next step is I'm going to put on an eye shield. So the eye shield protects the face and anything else that could be contaminated. So we're going to go ahead and put that on. When we wear our eye shield, it's down nice and low to make sure that we get full coverage. So from head to toe here, I have full coverage of my PPE. So the next and the last thing that I would do is put on my gloves. So when we're going into rooms, all of our equipment that is in the room for these patients that I talked about that are under suspicion is all disposable. So whatever goes in the room stays in the room. Nothing comes back out to us. So here I am in full protective equipment. So my full PPE is on. I'm protected and I'm safe to go in the room to see the patient. So when we're removing this, we have to be very careful because we are contaminated from going into the room with these patients. So the first thing we want to do is take the gloves off. They're the most contaminated, they're the first things to come off. So when we take them off, we make sure that we have very little contact with them. So these are off, they go in the garbage. The next thing I want to do is I want to take my face shield off. So I'm always going to pull from the back. You never touch the front. That's obviously the contaminated area. So we pull from the back. So the next thing I have is my gown. So I want to take this off carefully. I can untie in the back. We again don't want to be touching the front surface because my gloves are off. So untying in the back is important. And then I want to make sure that I'm taking it off without touching. So we can pull from here and we rip it right off. So as we do that, we fold it into itself so that again, we have the least amount of contamination as possible. Okay? Lastly, I have my mask. It's the last thing I take off. As I'm exiting the room, I am going ahead and I'm taking it off again. We're pulling from the back. We're never touching the front, anything that could have been exposed. So as that comes off, I don't touch any other part of the mask, and I go ahead and discard that. So that is proper removal of PPE. That is the most important aspect of that.
And Julie, is that different than any other infectious disease if we had a healthcare provider who needed to take somebody with protective equipment on? Are we treating COVID-19 patients any differently?
We're treating them as it's a respiratory illness, so an airborne illness. So this is the proper PPE that the CDC recommends for full protection on our patients that are undergoing airborne isolation.
And if in one of our hospitals somebody had a question, they could ask their supervisor.
They could absolutely reach out to their supervisor if they are concerned about what size mask they wear. Those are all things that they can reach out to whoever their supervisor is and ask them if they can get retested or if there's any questions they can be answered.
And if a physician has a question?
Absolutely go to our employee health nurse who would certainly go ahead and make sure that they are mask fit tested appropriately, making sure that they've had any questions with their PPE, that we are offering that to them. We can show them how to put it on and take it off. We actually have specific individuals on each unit who is the champion of this and is educating the physicians in real time and the staff in real time. So we have a good watch on this process.
Excellent. Thank you, Julie.
So lastly, one of the questions I think we have from a facility standpoint is how do our employees, how does the community, how do our physicians stay informed on what the changes are, what's coming up, any of that information?
Absolutely. And that's really one of the reasons that we put together this video is understanding that we need to get information out quickly, respond to questions that our community, our doctors, our staff have. And so we'll be doing these videos on a regular basis. They will complement our weekly newsletter, and we will continue, of course, to have communications on every unit and within medical staff leadership. So we want to hear from you. So send us your questions. Go to your hospital Facebook site, send in your questions. We will answer those regularly. So we look forward to hearing from you, and we want to be responsive. We understand this is a very stressful time, an unprecedented time, and so how we work together as healthcare providers and as leaders and continuing to educate people with the best information that we have is really the best way to combat this situation.
So how are we getting our information? From what resources do we get our information in terms of what we should be doing from a hospital standpoint, what the guidelines are? How do we get that?
So we look at a number of resource points. Obviously the CDC is the federal agency that gives us advice. We also look at state and local advice, which may be more restrictive. So the Florida Department of Health and the Agency for Healthcare Administration, any advice they have at the state, and then our local county. So we participate at the county level in emergency planning, and so we look at all those layers, federal, state, and county, and provide guidance to our team based on the most current information that we have from those sources.
And there's a lot of information on there for people in the public, for healthcare providers, so that's also a good place for them to go get some information as well.
That's a great point. So I would encourage anyone who has a question to go to those websites, the CDC, the Department of Health, Palm Beach County, and take a look. They post information on a regular basis, and the more people are educated, the better off we will be in terms of containing COVID-19.
So Maggie, thanks so much for taking the time today to answer all these questions that I know is on everybody's mind, and we appreciate your time for that.
I'm happy to do it, and I want to extend my sincerest thanks to all of our caregivers, our staff, our physicians, first responders, and the families out there. I know we're going through a very difficult time right now. And for the people who are on the front lines, I know it's very hard for you. So please know that we're here to support you. We're doing everything we can to navigate through these uncharted waters. And while we're used to managing in disaster situations and emergencies, we're certainly in an unprecedented time managing through a pandemic. So thank you. Thank you for what you're doing. Thank you for taking care of our patients in our community. Thank you for taking care of our staff. And just know that we are here for you. We are all in this together.